I'm just going to move the chat box out of the way here. Okay. Good morning, everyone, and thanks for the opportunity to present my project here today. My project is titled Interventions to Improve Equity in Emergency Departments for Indigenous People, Results from a Scoping Review. And this work was supervised by Dr. Patrick MacLean at the University of Alberta, Department of Emergency Medicine. Brief land acknowledgement. Today I'm presenting from Mohkinstsis, the Blackfoot name for Calgary, Alberta, and I'd like to take a moment to acknowledge the traditional territories and oral practices of the Blackfoot nations, which include the Siksika, the Piikani, and the Kainai. I would also like to acknowledge the Tsuut'ina and Stoney Nakoda First Nations, the Métis Nation Region 3, and all people who make their homes in the Treaty 7 region of Southern Alberta. So some brief background here. I think we are all aware of the fact that there are significant disparities in health outcomes for Indigenous people. This has been shown across settings with a history of white settler colonialism, including Canada, the USA, Australia, and New Zealand. Some brief examples include disparities in life expectancy and chronic disease incidence and prevalence. And we know as well that these inequities are related to social determinants of health, as well as historic and ongoing colonial structures and attitudes. A bit more background, the healthcare system in and of itself not only fails to address these inequities, but also further exacerbates these inequities via ongoing embedded colonial structures and attitudes, including racism. And particular to this scoping review, there's been a fairly significant amount of recent evidence from emergency departments in Canada that have shown First Nations people experience racist attitudes and structures within healthcare systems, including emergency departments, are subject to racist comments from staff and other patients, experience inequity in the triage process, and results from the global literature have shown higher rates of incomplete care visits in emergency departments for Indigenous folks. So the objective of this scoping review was to document interventions implemented in Canada, the USA, Australian, and New Zealand emergency departments to reduce inequities in healthcare experienced by Indigenous people. The methods of this scoping review, so informed by the Arksey and O'Malley framework, as well as the most recent JBI guidelines. There was a systematic search done of CINAHL, Medline, Scopus, Embase, and the bibliography of Indigenous People of North America databases. There were no date restrictions, and the search was completed in February of this year. You can see here the Prisma diagram on the right. There were 3,251 abstracts included for screening. I wanted to briefly chat about inclusion and exclusion criteria. I won't go over all of these, but the inclusion criteria, the first one on the top left there, you'll see the intervention policy or program must be designed to improve care for Indigenous populations as a focus group, and this must be identified prior to implementation. There's a number of equity-related studies that report on Indigenous outcomes of the study in a post hoc manner and don't have a priori methodology to improve equity in care for Indigenous folks. So those were excluded. I wanted to chat about one of the exclusion criteria. So it was a difficult decision, but we elected to exclude educational only initiatives. So this includes cultural safety training, EDI training, medical education, curriculum development. And this fits very much with the levels of the determinants of health that Dr. Greenwood mentioned this morning. We elected to focus more on those systemic determinants of health. This was based on the philosophy of this review, as well as previously published literature, that the inequities experienced are systemic issues and thus require systemic solutions. So that was the focus of this study. The results here, there were 9 included studies, 7 included interventions, and these were grouped into 3 categories. There were still 2 individual level interventions that did meet these inclusion criteria, and these included interventions where a Aboriginal health liaison was employed in emergency departments, thus meeting criteria, but again, not addressing the wider structure of the emergency department itself. The second group of identified studies were chronic disease screening programs. One was a diabetes screening program that was implemented, and one was a hepatitis C screening program. And finally, the interventions we were most interested in, there were 3 system/organizational oriented intervention. A few more pieces from the results. Co-design and implementation with Indigenous partners occurred in 5 out of 7 of the interventions. And notably, the 2 where they did not occur were the chronic disease screening programs. And these were actually identified as culturally unsafe by the study team. These interventions used an inferred or an implied consent procedure, and there wasn't a culturally safe, informed consent that took place prior to the screening. So in our review, we chat more about the harms that these interventions can have in and of themselves. An example of one of the organizational level interventions that was included is the EQUIP ED study. This is a branch of the larger EQUIP study being done in British Columbia. And this study was an organizational level intervention to improve the quality at the point of care for those who face health inequities in emergency departments. Now, this intervention, they gave EDs the tools to develop their own interventions. And this was a concept of frontline ownership. So 3 EDs within BC, one Interior, Vancouver, and Northern Emergency Department. The study team implemented or facilitated the development of working groups in these emergency departments, staffed by frontline workers. The study team provided change coaches to facilitate organizational level change that was identified as a need by the working groups. And they provided these working groups with learning modules and training regarding the principles of equity-oriented healthcare. After this, each ED was able to implement their own interventions unique to their population that they served. Now, the results of the study, unfortunately, they weren't robust. Only 1 ED showed a significant decrease in the percentage of patients who left without being seen. There are other metrics as well, but a number of the quantitative metrics were non-significant. There are some more qualitative pieces that we chat about in our scoping review. It is worth noting that the interventions were limited fairly severely by COVID interruptions, just given the timing of the study. But this is a case example of one of the organizational change interventions. To summarize and interpret these results, there's very few reports that have been published in peer-reviewed literature relating to interventions focused towards improving the equity of healthcare for Indigenous people in emergency departments. We did look at gray literature, but given the time frame, it was not tenable to sort through all of the gray literature for this scoping review. The next point here is that interventions aiming to create system-level organizational changes are promising, though these are the minority of interventions. And finally, we would just like to highlight that co-design and implementation with Indigenous partners is a critical step in these interventions. Thank you.